Today we'll be exploring art therapy and the treatment of anger and aggression for children and youth. Anger is a feeling, and it's normal and acceptable to feel. The way people show and practice their anger, however, can fall into the category of aggression. Anger is the root of aggression. Aggression is action or threat of action with intent to harm. Aggression problems in children can have a long-term impact. Children with serious aggression problems are more likely to develop other mental health issues, to struggle with substance use issues, and to engage in acts of violence as adults. It's important to acknowledge aggressiveness in childhood and adolescence because it can indicate so much more happening below the surface. Children with aggression issues may be dealing with social maladjustment. Aggression is based on psychological features like self-centeredness. If aggressiveness is intensified in adolescence, it's likely because the negative emotional experience of a child, or their lack of self-confidence, or high tension requirements in communication. Aggression in children indicates that there are barriers in interpersonal perception and interaction. Children and adolescents who are aggressive likely deal with feelings of alienation, isolation, and psychological discomfort. Anger and aggression can appear without physical harm in a multitude of ways. This can look like verbal and social aggression, angry outbursts, temper tantrums and yelling, irritable, blameful, and argumentative behaviors, sadness and poor self-esteem, excluding and isolating others, spreading gossip or rumors, manipulating friendships, lying, cheating, or stealing, or bullying, which is repeated aggressive behavior of any kind. But anger and aggression can also appear with physical harm in a multitude of ways. That could be poking, pinching, pushing, shoving, spitting, tripping, hitting or kicking, even throwing things, destroying property, setting things on fire, insults, taunts, threats, intimidating others, biting parents, school staff, or other students, non-consensual sexual acts of any kind, and a marked lack of empathy or remorse. There are important questions to ask when considering if a child has aggression problems, such as, does the behavior occur regularly? Does it persist or appear to be getting worse? Is it difficult to calm the young person down after an outburst? Does it lead to conflict with parents, siblings, peers, or teachers? And it's important to remember there are causes and risk factors for every child when it comes to developing problems with anger and aggression. A child may deal with difficult temperament, poor emotional control, poor social skills, substance use, or certain mental health problems, which will increase their risk of aggression problems. However, if a child is optimistic, empathetic, if they have a high self-esteem, strong cultural identity, and high emotional intelligence, they have protective factors against developing aggression issues. This can also occur on an environmental and familial scale. If a child is dealing with inconsistent discipline and lack of appropriate supervision, if their parents are aggressive or non-communicative, if they're dealing with family instability, neglect, abuse, and substance abuse, a socially disadvantaged condition or environment, and if they're around friends who behave aggressively, they're more likely to develop aggression problems. However, if a child is exposed to firm, fair, and consistent discipline, appropriate supervision, a comforting and secure attachment to their caregivers with family stability, socially advantaged neighborhoods and schools, and success at school and attachment to community, they have protective factors against aggression problems. When dealing with an aggressive or angry child experiencing an episode, there are ways to help calm and diffuse the situation. First of all, control your body language and tone of voice. Stay calm, express appropriate concern, and remind the child you're there to help. Do not try to solve the problem or conflict while they're acting aggressively, and offer a way out. In the long run, art therapy is an excellent way to help children with maladaptive behaviors regarding anger and aggression. Art therapy is a less threatening intervention to work with children. Art is a natural language and tendency for most children, and art therapy could be used to work with emotionally disordered children. Art therapy allows an outlet for children to depict their experiences and express their emotions. With art therapy, children can learn to reframe negative emotions and thoughts, including anger and aggression. Art therapy can be used to reduce anger most of the time by allowing children to express anger in a symbolic way. They can learn to develop metaphors for anger in order to better understand it. It also allows them to express feelings that mask anger and express the feelings behind their anger in order to discover the root. Art therapy also allows children to engage in exercise to look at their anger in new ways and overall replace anger with creativity. Taking a cognitive behavioral approach to art therapy can help replace aggression with more productive and positive ways of thinking and acting. CBT-informed art therapy allows children to recognize dysfunctional ideas and beliefs that children hold about themselves. They learn to self-monitor and develop problem-solving strategies. They also learn coping responses and new skills when it comes to their anger and aggression. While cognitive behavioral art therapy can be effective in managing anger and aggression, an eclectic approach may be the most desirable for art therapists working with aggressive children. With an eclectic approach, art therapy can provide the ideal situation to help respondents learn anger management skills through art activities and through the therapist modeling less violent methods of communicating. Research shows positive responses to art therapy in varying degrees depending on the degree and varying intensity of aggression in children. For clients in art therapy learning to manage their anger and aggression, the major factors facilitating their positive response were empathy, validating experiences, the art therapy process, and reflective listening. Art therapy provides opportunities for all of these things to take place. There really is just a huge value of art therapy for the treatment of anger and aggression. Art therapy allows children to harmonize their development through self-expression and self-discovery. The value of this application of art in correctional and rehabilitational purposes is that it can be used on a symbolic level to express and explore a wide range of emotions. This is absolutely the case for children in art therapy. Research and case studies indicate that art therapy is effective in reducing the level of aggression and overcoming hostility in adolescents and children. Art therapy interventions can help children access feelings of calm and allows them to ground themselves. Effective interventions can also allow aggressive children to process the source of their anger and get in touch with their body. It's important that children are in a comfortable setting with an art therapist who allows them to feel the full spectrum of their emotions without judgment. It's okay to feel anger. It's what we do with the anger that is important to monitor and manage. A great art therapy intervention for children learning to manage their anger involves working with clay. First, mindfulness is important. When working with a child, have them bring their attention to their breath, gently breathing in and out until they reach a state of calm and groundedness. Next, still breathing in and out, ask them to massage the clay in their hands. Match the movements of their hands to their breath. Reflect, what sensations arrive in the body when I feel angry? Using the clay, have the child create an angry animal, something that they can channel their anger into. What are the animal's physical features? How big is it? How does it sound? How does it look? Does it have features on its face? How big? How small? After the child has created their angry animal, have them reflect. Express what the angry animal is afraid of. Why does it feel angry? What is it trying to protect? What makes it angry? How does it protect those things that are precious to them? If necessary, make guesses. Working with clay is a kinesthetic experience that releases tension, stimulates energy, and helps discharge it through movement. So, firstly, the exercise allows children to engage in a physical exercise that tangibly releases their tension. But it also allows them to externalize their feelings of anger, and it gives their anger a physical form outside of them. This process helps children to process and understand their anger and aggression. Overall, children with aggression issues may suffer serious and long-term consequences. But the earlier a young person is identified and receives help, the greater chance of their treatment working and lasting. Art therapy is a proven effective intervention for children with anger and aggression difficulties. It allows them to depict their experiences and process their emotions. Art therapists can work with children who have issues with anger and aggression to reduce their level of aggression and to help them overcome these feelings of anger and hostility. Children can engage with art therapy to learn to process their anger in a healthier and more productive way. Thank you.